Hi, I'm Dr. Gerard Guillory, President and founder of the Care Group PC. Welcome to this presentation on leaky gut syndrome. Leaky gut, also referred to as increased mucosal permeability, is a real disorder that affects the lining of the intestine. It is a classic example of how disruption in one organ system, in this case the intestine, can cause problems throughout the body. If you suffer from digestive symptoms, joint aches, allergies, mood disorders, skin disorders, or chronic fatigue syndrome, you may actually have a leaky gut as the root cause of your problem. In the past, leaky gut syndrome has not been widely accepted by conventional physicians. I recently reviewed a Medscape presentation by Dr. Michael Camilleri from the Mayo Clinic entitled Pathophysiology of Irritable Bowel Syndrome. As you may know, irritable bowel syndrome, or IBS, is a common digestive disorder that I have been interested in for many years, having written the first book for sufferers in 1989. In his presentation, Dr. Camilleri discusses how the current understanding of the pathophysiology or causes of IBS has changed over the past decade. In the past, IBS was felt to be more of a psychosomatic disorder, and many patients were led to believe that the symptoms were all in their head. There now is an appreciation for the fact that many IBS patients actually have increased mucosal permeability in the intestine, or what alternative practitioners have referred to over the years as leaky gut. I am happy to report that the notion of leaky gut is beginning to obtain some credibility with mainstream practitioners. You should take comfort in knowing that if you have been diagnosed with IBS, you have a real disorder, and we are beginning to understand some of the root causes. IBS is just one of many conditions that may be associated with a leaky gut. So, what causes your gut to be leaky? There are several mechanisms that can disrupt the integrity of the lining of the intestine, allowing larger bacterial and food particles to enter the bloodstream, which in turn can activate the immune system, causing a range of digestive and non-digestive symptoms. In fact, many patients I see have problems which have their basis in leaky gut, while at the same time they are experiencing no digestive complaints at all. As an example, 40% of patients with a gluten sensitivity skin rash, referred to as dermatitis herpetiformis, will have no digestive symptoms. Immune-mediated responses to foods, like the protein gluten found in wheat, excessive bile acid, chronic use of gastrointestinal irritating medications such as ibuprofen, or various pathogenic microorganisms such as yeast, bacteria, or parasites can all lead to the myriad of symptoms associated with a leaky gut. Gluten sensitivity is on the rise, and gluten sensitivity is the prototype of food reactions that can lead to leaky gut. In recent years, there has been an increased consumption of gluten-containing processed foods and grains, especially the gluten-laden modern-day genetically modified wheat. This in part explains why there has been a recent buzz regarding gluten sensitivity. Roughly 1 in 100 people suffer from the most severe form of gluten sensitivity, which is celiac disease. This is up from around 1 in 3,000 when I graduated from medical school in 1982. Patients that test negative for celiac disease are often told they don't have a problem with gluten. However, they might still be reacting to gluten, and it is estimated that up to 30% of the population have what has come to be referred to as non-celiac gluten sensitivity with associated leaky gut symptoms. This is but a brief example of the many factors which can lead to disruption in the so-called tight junctions between the cells lining the intestine. This upregulation of the immune system can lead to symptoms such as chronic fatigue, arthritis, increased food allergies, skin disorders, and mood disorders. In fact, many autoimmune disorders such as lupus, rheumatoid arthritis, and psoriasis have been linked back to gluten sensitivity and gluten's destructive effects on the bowel lining. So really, any exposure to disease-causing microbes, medications, toxins, or foods which lead to increased mucosal permeability may contribute to the development of autoimmune disorders. If I may paraphrase a quote from the journal Clinical Reviews of Allergy and Immunology, this new paradigm subverts traditional theories underlying the development of autoimmune diseases and suggests that these processes can be arrested if the interplay between genes and environmental triggers is prevented by reestablishing normal intestinal barrier function. Sometimes the best way to try and understand something is to look at a case study. This female patient, born in 1961, complained of weight gain, high blood pressure, and fatigue. A food allergy test was performed, and as you can see from the color key, red marks a severe reaction and green indicates no reaction, with various levels of intermediate reactions expressed by different colors. As you can see from the next 3 slides, her food allergy testing reveals multiple reactions to various foods. This is oftentimes seen in cases of leaky gut, as the body is more likely to make antibodies to these larger food particles that under normal circumstances would not make it into the bloodstream. Imagine a coffee filter. Holes have been punched into the filter, and now larger coffee grinds get into the coffee. This is what happens with leaky gut, and the inflammatory cells, 70% of which reside in the lining of the intestine, become activated and begin to attack these food particles in much the same way they might fight a foreign invader, such as a bacterial infection. In essence, there is a war being waged in the small intestine. This can lead to inflammation in the intestine and inflammation in distant sites throughout the body. The patient was placed on a leaky gut protocol consisting of probiotics and various other components designed to help repair the small bowel lining and reestablish the friendly gut bacteria. This approach, also referred to as the 4 R's, consists of removing anything that might be causing the leaky gut, be it a food reaction such as gluten, medication such as ibuprofen, or a pathogenic microorganism such as yeast overgrowth. The second R is to replace any nutritional deficiencies created by the leaky gut. As an example, patients with leaky gut often become iron deficient, which can lead to its own set of symptoms. The third R is to re-inoculate the gut with probiotics. And the fourth R is to give supplements which will help support repair of the intestinal lining. Follow-up food allergy testing shows a marked decrease in the number and severity of reactions to the very same foods which the patient reacted to on initial testing. The patient has persistent, moderate reactions to gluten and a few other foods, but her overall reaction to foods has calmed down. She can now enjoy many of the same foods that would have wreaked havoc on her digestive tract previously. After only 3 months on the protocol, the patient had lost 33 pounds, blood pressure had normalized, and her energy level had improved significantly. As I often tell patients, heal the gut and heal the body. It was Hippocrates who said that all disease begins in the gut. Well, maybe not all disease, but certainly a large percentage of diseases may result from this seepage of toxins and sewage from the small intestine into the bloodstream, or what we call leaky gut. What I have learned over the years in treating patients with IBS is that increased mucosal permeability, or leaky gut, is at the root of the problem. As I worked with patients using probiotics and dietary modification, not only did their digestive symptoms improve, but many of the other problems mentioned above went away. I am glad to see that Dr. Camilleri and his colleagues are beginning to spread the word and not only validate what I have felt to be true, but also to validate IBS as a real illness. I hope that as our current understanding increases, we will begin to discover the range of factors which can lead to leaky gut and the multiple adverse health effects which can occur as a result of it. Thank you.